Pairing community wisdom with access to institutions. The importance of the LGBTQ community liaisons. Recognizing intersectionality. MDH is dedicated to serving all Minnesotans, and that means addressing health equity. The LGBTQ community faces unique challenges as it intersects with several communities that experience similar inequities. Quote, the LGBTQ community is also African American, American Indian, refugees and immigrants, and more, end quote, said Maddie Jensen, LGBTQ community liaison at MDH. Jensen and Shore Salkis make up the LGBTQ community liaison team at MDH. Their role is to connect with the LGBTQ community members to ensure that they have access to education and information about COVID-19 prevention, testing and care, and to provide an open line of communication for them to share concerns and requests with MDH. Our liaisons have been flexible and responsive to the community needs during the changing pandemic. They collaborate with local organizations, speak at events and conferences, answer community members' questions, and advocate internally at MDH for the needs of the LGBTQ community. For Jensen and Salkis, this work is personal. Their friend and family networks have been key to getting this work done. As leaders in their communities, the line between work and personal lives has blurred. But the common thread has been a fervent desire to keep their communities safe during this time. Quote, I feel like I'm texting people all the time or on Facebook, Salkis explained. Quote, I'm always communicating with people about COVID-19 in the community, end quote. Because of their passionate work, the LGBT community has had access to an additional trusted source of information to stay safe during the pandemic. While the LGBT community faces many of the same obstacles that others are experiencing health inequities do, some concerns are especially challenging. Quote, while social isolation is happening to all people who are practicing stay safe precautions, for LGBTQ people, this is particularly difficult because they might have chosen families that they may not live with. If you live in a home with people who are not supportive of your identities or where you do not feel connected, this isolation is deeply felt, end quote, said Jensen. In addition, LGBTQ elders are experiencing barriers to health and well-being because they may not have supportive extended families or feel safe in elder care environments. Connecting and sharing. One of the ways that the LGBTQ community liaison team opened conversations and brought resources to the community was through a bi-weekly open calls in partnership with the City of Minneapolis this past spring and summer. The calls enabled state and city leaders to share vital information with the LGBTQ community while also bringing in trusted leaders on different topics to share with the community members. Salkis said, quote, we needed a place to see each other and talk about these things because they were changing so fast. There was a need for connection more broadly, so we started bringing people together for information and updates, end quote. A key aspect was open dialogue and creating a place with two-way resource sharing and problem solving in real time. The LGBTQ community was eager to participate, Jensen recalled. Quote, everybody we reached out for out to for panel discussion said yes. Everyone was really eager to show up for each other. Everyone wanted to make time for it. That was really beautiful, end quote. Track Trachtenberg, Trans Equity Project Coordinator with the City of Minneapolis, was a key partner in the work. They said, quote, I've definitely appreciated working with Shore and Maddie and getting access to updated COVID information that they could provide, end quote. Challenges still remain with reaching all community members, Trachtenberg shared. Quote, although we were reasonably successful in reaching a diverse group of service providers, often at local organizations, and although we were successful at developing diverse panels of subject matter experts in various areas, we were often reaching community members directly unless they were we were often not reaching community members directly unless they were organization affiliated. Reaching as many members as possible requires strong collaboration with trusted community messengers. Jensen and Sulkus worked with community contractors and lead organizations in the community to leverage their connections and local wisdom. Quote, I cannot stress enough how important it is that the information come from trusted community sources, end quote. Jensen said, quote, they have a better idea of what's going on in the community. They can be more nimble and flexible, end quote. Advocacy and positive change. The LGBTQ community liaison team has also served as advocates for increasing inclusion and equity across the MDH COVID-19 response. Jensen and Sulkus' effort have resulted in the beginnings of sexual orientation and gender identity data collection at community testing sites and during case interviews. As a part of this work, they led trainings to educate case interviewers on the best ways to collect this data and how to respond if an interviewee expresses concerns about the questions. Jensen and Sulkus have also remained available for case interviewers to reach with any additional questions on an ongoing basis. This work is crucial to being able to track and monitor the impact of the COVID-19 pandemic on the LGBTQ communities. Without the data, the only way to know what is happening is through anecdotal evidence and stories. The team is also creating a guide for testing site workers to ensure that they are providing a safe, welcoming, truly barrier-free environment for all Minnesotans who come for COVID-19 testing. Sulkus and Jensen have been repeatedly recognized by their MDH colleagues as key leaders, and they continually push for equity at MDH. They continue to work alongside community leaders to ensure that the needs of the LGBTQ community are met during the COVID-19 pandemic.